My name is Honorable Professor Paul Sunday Nnamchi. I represent the good people of Enugu State. My motion this one is the urgent need to review the National Health Insurance Scheme's medicine price list in view of the nation's present economic situation. The House notes that the safety and well-being of Nigerians is of paramount concern to this legislative body. He said to the People's House. Further note that National Health Insurance Scheme, NHIS, overseen by the National Health Insurance Authority as established by Act 35 of 2022, serves as a critical lifeline for millions of our citizens. Is envisioned to providing access to affordable, essential, and quality health services and medicine for all Nigerians. Aware that our nation is grappling with economic hardship, inflationary pressures, and rising cost of living, which have had a profound impact on the affordability and accessibility of healthcare services and medications for many of our citizens, particularly the vulnerable and marginalized sections of the society. Perhaps that the existing medicine price lists under the NHIS framework no longer align with the current market dynamics and cost structures of pharmaceutical products, as the last NHIS price list review was in 2021, when the exchange rate was between 400 to 420 Nigerian naira to a dollar, as against the current official rate of 1,594 as at the time of this motion to $1. Disturbed that many vulnerable patients, especially the marginalized section of the society, are finding it increasingly difficult to get essential and quality medication in the health management organization, leading to adverse health outcomes and exacerbating the burden of illness on our healthcare system. Regrets that no urgent action is taken, loss of life will continue to deepen while the economic devastation to the nation continues to increase. I appreciate that it is imperative to address this pressing issue without delay and take proactive steps to ensure that our NHS remains effective in fulfilling its mandate of providing quality healthcare services to Nigerians. The House resolved thus to mandate the Committee on Finance, Health Institution, Healthcare Services, and Specialist Health Services to liaise with the Federal Ministry of Health, National Health Insurance Authority, and other relevant authorities to take necessary and urgent measures to ensure a comprehensive review of the medicines price list under the National Health Insurance Scheme and report back to the House within 2 weeks. Secondly, the House mandated the Committee on Legislative Compliance to ensure implementation. Mr. Speaker, I so move. Thank you.
Any seconder? Any seconder to the first leg?
Ever since the cost of living started going up, the floating of the dollar, nobody has ever thought that the list or the price list of medication for National Health Insurance Scheme should also be changed. Because when you go to the hospital, what the majority of the populace that depend on National Health Insurance for their survival or for their medications don't get the right drug again because the hospital cannot afford to pay it. The list is still as at 2021, when the dollar was at 300 to 400, or at the most 420. And most of these drugs are imported, cannot be paid by these NHS stuff. And what happens is that people don't give them the drugs. They give them something that is inferior. They give them what they don't need. And to forestall these things, we need to care for our people. And that's why I've made this bill that the price list be reviewed to the present condition where the dollar is $1 to 1,500 and more, or 500 or 600 as the case may be. Now, it is pertinent to say that most of the people that use this are these most civil servants or civil service or people in public service that may not have any other source of income apart from the government payment. So it's a very timely bill. or it's also a bill worthy of urgent action. And that's why I moved it with an urgent motion for urgent national importance.